I'm Dr. Chintan Doshi, a pediatric orthopedic surgeon from Mumbai. I've done my specialization in pediatric orthopedics from Mumbai. I've done my super specialization from Singapore and US. And we are here today to talk on different conditions of pediatric orthopedics which we face in daily life. So, clubfoot is a deformity of the foot. It is actually the full form is CTEV, that is congenital Equinovarus. And in this, the foot of the child who's born is deviated inwards. And the foot is such that it looks deformed, and parents are very scared while looking at the feet. So basically, it is a deformity of the foot which appears right at birth. Sometimes the deformity is very mild and then it progresses as the child grows if it is neurological or a clubfoot of syndromic origin. So basically, clubfoot comprises of deformities of foot where the foot is turned inwards, is turned downwards, and there is a lot of curvature to the foot which does not enable a child to walk normally. There are a lot of myths and superstitions attached to this. However, clubfoot is no one's fault. Clubfoot can occur to a absolutely normal pregnant lady, a child who's born, who's getting formed in the womb of a pregnant lady, can have a clubfoot right from the first trimester itself. Sometimes it presents very late during the pregnancy. However, this is not due to any intake of any particular substance, or it is not due to exposure to any external environmental factors. It is just the formation of the bones and the muscles and the tissues in a position of a clubfoot. Yes, there are some correlations where if the liquor is less or there is less space in the womb of a pregnant lady and the child is a little bigger size, to accommodate the child assumes a position of clubfoot, and this will eventually lead to a clubfoot as the child is born and will be seen as a deformity when the child is born. When the child is born with a clubfoot, it is only a deformity. It is a deformed looking foot which the parents are worried about. Child does not complain of any pain. Child does not have any other symptoms. Child is nicely, happily kicking. But it is what is seen on the foot of the child, the deformity, the abnormal shape of the foot, which is worrisome. That is what is the main symptom. As the age progresses, and if it is not corrected, if the child is walking on the deformed foot, it can later on eventually lead to pain, bony prominences, skin conditions, ulcers, and all other problems. But that is later in the older age group, as when it is not treated. But per se, clubfoot, when the child is born, it is just the deformity. There is no other symptoms. The diagnosis of clubfoot is basically can be antenatal, which is when the mother is pregnant and when the sonographies are done. A very good sonologist can pick up a position of a clubfoot throughout the pregnancy. It can be during the anomaly scan, it can be during the third trimester scan, it can be during any of the scans. It may be shown as a normal foot because the actual clubfoot position may not be seen on a sonography. But when the child is born, that is a real time when we come to know that it is a clubfoot, and it is the deformity which the child is born with, what is seen to the gynecologists, pediatricians, and the pediatric orthopedic surgeons, that is clubfoot. So that is how it is diagnosed. Now coming to the treatment of clubfoot is by manually correcting the deformity. So when it is just positional clubfoot, which is a very milder stage of clubfoot, it can be done by mother manipulations. We teach mother how to do exercises and get it corrected. So this is for positional clubfoot. The clubfoot which are little more rigid, which cannot be amenable to mother's manipulation and correction. What we do is we do Panseti maneuver. In Panseti maneuver, we do serial casting. We slowly correct the deformity of the foot. And as the foot is corrected, we change casts weekly. So if we apply on in the first week of the baby, then we do second cast in the second week, third cast in the third week, and so on. Approximately 4 to 6 casts are required to correct an idiopathic clubfoot. And once the foot is completely corrected, a small procedure of tenotomy and followed by bracing is what is advocated as a treatment of choice for clubfoot. Treatment by correcting the deformity by plaster application is completely painless. Yes, children sometimes cry when we apply plasters, but that is not because of the pain. That is because of it is something new to the child. They are not used to having plasters on the foot. So that is why they are not comfortable. So it is basically a feeling of, so a child will cry when he's hungry. A newborn will cry when he's hungry, when uncomfortable, when painful. So it is basically the comfort of the child which is getting hampered with. That is why the child is crying, because most of the times when we proceed with the plastering, almost 5 minutes into the plaster, the child always goes off to sleep and is no more crying. So actually, it is not painful. If it was painful, the child would have cried all throughout the week when the plaster was applied on the foot. However, once the plaster is applied and the child is and no one is touching the foot, the child is completely relaxed and often goes off to sleep while applying the plaster as well. So it is not painful to the child and is absolutely comfortable once the plaster application is completed. The do's and don'ts during the casting phase is that when the cast is applied, it is important that the parents keep the cast neat and tidy. It should not get soiled with urine, stool, or while cleaning the child, not with soaked with water or anything. So for the entire week, the plaster has to be neat and tidy. That is during the plastering phase. When the child is onto the bracing phase, the later part of the treatment, the braces are to be continued for 3 to 4 years of life. And during that period of time, it is important that they follow the time duration and the protocol for which the bracing is to be applied. This is the most important and the most neglected part of the treatment. If the parents don't make the child wear the brace at appropriate times, the clubfoot will reoccur. And once it reoccurs, then the treatment is prolonged for a very long time, and the child may have to undergo unnecessary surgery when the child is of older age. So it is important that they follow the protocol for bracing. The braces are to be applied throughout the day in the initial period. And once the child is of a walking age, we apply it only when the child is sleeping for nights and naps. It is something which is occurring when the child is being formed inside the womb of a mother. So it is something which cannot be prevented. It is nothing that I give a medicine to a mother and I say you take this medicine and your child will not have a clubfoot. It is not possible. It is that thing is not possible. So there is nothing that a mother can do, sleep on this position or take some medicine and by which the clubfoot will not occur. It is, if it is bound to happen, it is bound to happen. The good thing about clubfoot is, if the child is born with a clubfoot, there is complete cure and there is complete treatment, and it is without any surgery. That is scarless. There is no scar. We can correct if the parents present to us early stage of life, when the child is a newborn, 1 or 2 weeks old, and we start with casting, we can treat the child, bring him to a normal position of the foot, and which will eventually, when the child is an adult or a sportsman, or when he is becoming something important in the society, he will not have that stigma of having a deformed foot, and he will have a normal foot like all of us.